But Amy, clearly at this point it's a good time to bring up the donut hole, or the infamous donut hole, where, if I understand correctly, $2,200 is the average that people were paying for prescription drugs. With the Medicare plan, they're spending on average $1,100, but there's this gap that if you spend over a certain amount on prescription drugs, you fall into this hole. Can you explain why that's there and what that's all about?
Sure. Congress created the law so that they could help a lot of people help save money on their prescriptions. On average, like you said, about $1,200. And so after they've gone through a certain dollar amount, they do hit what we call the coverage gap. And then once they've gone through that coverage gap, in 2006, once they've paid $3,600 out of pocket on their drugs, that's when they reach catastrophic coverage. And that's one of the really good things about Medicare Part D, is that catastrophic coverage. So they really wanted to help people in the beginning, and they really wanted to be able to provide catastrophic coverage. So if somebody does have something happen, you know, they will have that coverage. Because after they've reached that limit, they're going to have to pay very little for their drug costs. On average, no more than 5%. 5%.
Mm-hmm. It's still very confusing, and I know that Medicare or CMS is trying desperately to get information out. What are you doing to make that happen?
There's all sorts of information going out. One of the big things was the Medicare and You 2007 handbook. So every house that has a person with Medicare in it received one of these Medicare and You handbooks the end of October, 1st of November. And it talks about their Medicare coverage, including Part D. So that's one of the big things that's gone out. There's also a lot of information on the Medicare.gov website about the prescription drug plans, and can help them compare plans. And all the same information is available on 1-800-MEDICARE for a person who can call 1-800-MEDICARE.
And I also just want to show Tricia the book that you put together, which is a planning guide on Medicare Prescription Drug Plan Guide. If an individual has a spouse that is a part of Medicare, how does it work in terms of families?
Well, it depends on, I'm assuming that the question you're asking is one person is qualified, let's say is 65 years old or older, and the other person is younger. Until then, you have two different kinds of coverage. The person who's under the age of 65 is not yet on Medicare. They're getting their insurance separately, whether that be from an employer or individually purchased, and the person who's on Medicare gets their coverage through the Medicare program. That's the way the Medicare program has worked, not just for Part D, but for everything.
And how about if your spouse is deceased?
If your spouse is deceased and that person qualified for Medicare coverage and you had Medicare coverage while they were alive, you continue to get it as the recipient of that coverage. My mother, for example, is in precisely that situation. My father died, and she has insurance coverage based on my father's payment of Social Security.
Amy, before we close, what is the enrollment period for this?
The enrollment period, everybody has an initial enrollment period like Tricia talked about. But then what's coming up right now is actually what we call the annual coordinated election period, or the open enrollment period. You may hear it called that. It's from November 15th to December 31st.
And people can either join into the prescription D, Medicare Plan D, or they can change their plan during that open enrollment period, right?
That's exactly right. And the change they make is going to be effective January 1st, 2007.
Great information. You have cleared up so much for our audience. We appreciate your time.
Thank you.
We need to take one more quick break. I'll be back shortly with some closing thoughts. But before we go, here are some takeaway points on Medicare Part D that I'm sure you'll want to jot down for future reference.
Medicare Part D. Under Medicare Part D, most people save about 50% on their drug costs. If you currently have no prescription drug insurance and do not sign up for Medicare Part D during the open enrollment period, you will be penalized 1% per month until the next open enrollment date. If you currently do have creditable coverage, which is health insurance with prescription drug coverage equal to that of Medicare Part D, you may switch to Medicare without penalties. If Medicare does not cover a particular prescription, ask your doctor to switch you to a medication that is covered. If your doctor feels this is not a good decision, he or she can ask Medicare to grant an exception to have the drug covered. Resources for learning more about Medicare and Medicare Part D. www.medicare.gov. 1-800-MEDICARE. The open enrollment period for Medicare Part D is November 15th through December 31st. People can either apply or change their plan which will go into effect January 1st, 2007.
Sounds like there's a lot to consider.
There is, John. And I'd like to emphasize a couple of points from that segment. Starting out, it's very important that you have organized all of your current health plan information and that you have all your prescription drug information, including dosage size. That will help you when you're comparing plans. And don't forget that open enrollment begins November 15th and ends December 31st. Even if you enrolled in a plan last year, your plan or your needs may have changed. So this is the time to make sure you are signed up for the best plan for you.
Be aware that it takes a while for the forms to be processed and activated, so the sooner one signs up, the better.
That's right. Our friends at Medicare tell us it's a good idea to sign up before December 8th to have your new plan in full force starting January 1st.
Medicare impacts nearly every American, either directly or because it affects one's parents or grandparents.
And that impact is felt in more ways than just health. There are financial repercussions as well.
Here's an excerpt from the Retirement Living series, The Prudent Advisor, where we discuss the financial ramifications of Medicare Part D.
We all need water to stay alive, and the price is hard to beat. It's the other life-sustaining things we swallow with water or medicine that can eat away at a household budget. But millions of seniors are paying less for their prescription drugs by signing up for Medicare Part D, saving an average of 27%. Beginning in mid-November, some beneficiaries may get a chance to save even more by changing their drug plans during the open enrollment period.
Well, we have the plans for 2007 in Maryland, and as you could see, there are more plans than there were last year.
I haven't seen this.
Rosemary Schlesinger chose a drug plan in the spring of 2006 that she thought was the best for her. Since then, though, her doctor added medicine to her drug list. The open enrollment period is Rosemary's only opportunity to change her plans. But first, she must compare her existing plan to 52 others available in her state next year. Medicare Part D is unlike any other insurance in that every year it's different.
And if you don't go to the computer, that makes it more difficult, I'm sure, for people. But from what I hear, they have programs out there that will help everyone. So people need to get out there and take a look at it or get someone to help them.
The price of Medicare prescription drug plans involves three parts: premiums, deductibles, and co-payments. The premiums range from $13 a month to $108 a month. Some of the plans have deductibles of up to $265 a year. That's the amount you pay before the insurance kicks in. And each plan has its own co-payment scale, a fixed percentage of the actual cost of the drug, which can vary among the plans for the same drug. It's good to note the actual cost of your drugs on your plan because it counts against the coverage gap or the donut hole. In 2007, beneficiaries will pay out of pocket once the actual cost of their drugs reaches $2,450. But after your out-of-pocket expenses add up to $3,800, you'll be eligible for catastrophic coverage. Medicare Part D will pay for 95% of your drug costs and even more if you qualify for low-income subsidy too. To qualify, your combined savings, investments, and real estate other than your home cannot add up to more than $11,500 if you're single or $23,000 if you're married and living with your spouse. On average, the subsidy is worth $3,700 a year. Some states even offer additional assistance, so it really pays to get help, even if you think you don't need it.
For some seniors, this is very difficult, this is confusing, and it's emotional because it affects their health care. I suspect that people last year were so involved in this and it was difficult to navigate the system that they say, I've done it once, I'm done, I'll stay with the plan I have because it was okay, not realizing that the plan they had for 2006 may be very different in 2007.